You know, I learned a lot of things that work through athletics and training other people, coaching and whatnot. But going to medical school, I learned the real reason, the physiology behind what makes them work. And so, you know, tying that all together is what I do now, which is sports, anti-aging, and some cosmetic medicine. I'd say the benefits to having done the Eastern medicine training are it teaches a doctor to be more attentive to some of the subtleties. Western medicine, if I had to generalize, is great in terms of emergent medicine for drastic cures, for drastic diseases, kind of the hit you over the head with a hammer type of stuff. If I got in a car accident, I'm not going to a Chinese medicine doctor. I'm going to the ER for the best allopathic medicine available. I mean, a typical presentation, someone who comes to me is they've already been to see their regular doctor, if you will, and they've complained about a lack of energy, a lack of libido, and they've either gotten an antidepressant, or the guy says, well, or the gal, you know, you're getting old. What are we going to do? Or just the standard line, there's nothing wrong with you. Okay? And yet, if you look a little deeper, there is. 35 to 45 or above, absolutely the first thing I look for, and most of the time I'm right. In testosterone replacement therapy, or BHRT, bioidentical hormone replacement therapy, specific to males, we know that the key hormone is testosterone, and it needs replacing. So we get the testosterone up to that which you might have, say, had in your 20s, okay, or even better. What are the keys to weight loss? The same stuff that's been around forever. I hate to reiterate it, but it's true. You got to watch what you eat. You got to get enough sleep, and you have to exercise. Okay, I say have to because I'm thinking in terms of getting to the goal the best way. Okay, we've known forever that if you eat more calories than you use, you're going to get fat. That's a simple equation that still holds true. There are ways to tweak that. Okay, in terms of how you eat, dividing your meals into small, frequent meals, frequent meaning every 4 hours, and small meaning about that big, okay? Maybe 300 or 400 calories if you want to count calories, okay? There are studies that show that those who do not get enough sleep, that factor alone, leaving everything else out of the picture, are fatter than others, okay? So that's another simple one. Your mom told you, you better get enough sleep. Whatever you're doing at 1 o'clock, you probably shouldn't be doing, or you could be done with by 11 anyway, right? And then lastly, the exercise. It leverages everything we do. If you don't have enough muscle, you don't have enough reason to eat all those calories. Muscles are the reasons why we have to eat so many calories. So it's as simple as that. The best thing in medicine that we know of, and if you ask any good dermatologist, if you pin him down, he'll tell you, there's really two things. You could choose between glycolic acid or Retin-A, the brand name, okay, retinoic acid. And the principle is basically the same. What you're trying to do is get the skin to crank up its ability to produce more newer, fresher skin, okay? You're creating more of a turnover. I always recommend it for people that come in for Botox, because with the Botox you stop the muscles from moving in a way that creates the wrinkle, and then to quickly eliminate the wrinkles that have already been formed there, you get rid of that wrinkled skin by increasing the turnover with Retin-A. So without a doubt, I recommend Retin-A as the best product out there for anti-aging for the skin.